Welcome to Nourish MD, Doctor-Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD. I'm Lauren Papanos, one of your hosts, and I'm joined by our co-host today, Romana Brennan. And we are also joined by our special guest today, who is Dr. Nguyen. Dr. Nguyen is going to be talking with us about pain management. He is the medical director at the Orthopedic Pain and Spine Center, and we are super excited to have him on the show today to be able to provide us some practical solutions for managing pain. So thank you so much, Dr. Nguyen, for being here, and welcome to the show.
All right. Thank you, Lauren. So again, my name is Dr. Nguyen, and I'm a pain management specialist. So just a little bit brief statement about myself. I am double board certified in pain medicine and physical medicine with more than a decade's worth of experience in these fields. I obtained my MD from the University of California, Davis, before returning to UCLA for residency and fellowship. And currently, as you mentioned, I'm serving as the medical director at Orthopedic Pain and Spine Center, which is a private practice located in Costa Mesa.
Awesome. Thank you. And in your specialty, what are some of the most common reasons that patients come to see you?
Yeah, absolutely. So probably the most common referral for patients to come see me has to do with neck and low back pain, stemming from strained muscles, herniated disc, sciatica, which is pretty common, or spinal stenosis. In addition, I also see a lot of other common orthopedic injuries, rotator cuff tear, hip arthritis, knee arthritis, fair share of headaches, disorders, migraines, TMJ disorder. And a small part of my practice also deals with neuropathy and cancer pain as well. And I would say probably one of the most common reasons patients come see me is because they're actually looking for options that may not involve surgery. They've already seen a surgeon, and the surgeons have decided maybe this is not a surgical case yet. The patients should explore all of their conservative management first before getting surgery. Or the patient themselves may not want surgery as a first step, or simply may not be a candidate for surgery for a variety of medical reasons.
Okay, so generally, would you say that a patient will be in pain, one of these relative areas you mentioned, and they might go see their family practice physician and then get referred over to an orthopedic physician, and then at that point, then they typically get referred over to you? Or at what point would you say that it really would be in patient's best interest to consider seeing someone like yourself?
Yeah, great question. I think probably, the main referral source that a lot of patients I get would be from surgeons. So either orthopedic surgeons or neurosurgeons themselves would be a lot of my referral source. And this is when I would see the patients as the first step towards conservative management. I'm just managing their pain, seeing, how much of an issue this is and whether this is something that they need surgery for. You also see a fair amount of patients from family practice, primary care as well. And, a good chunk of patients actually sees me just from, for example, when they search someone like myself, which specialize in non-surgical orthopedic care or pain management. And, sometimes I'm the first person that they see. And then I would be the one that would order any imaging studies and start them on physical therapy for that. Yeah. So, I would say it's very broad. I mean, I don't have a fixed, we don't have a fixed a case, for example, for patients to be seen in our clinic. I think it's fairly broad, and, patients are able to see me separately without referral as well.
And I'm sure because you're seeing such a broad case range that their treatment options are also quite broad, but I would love to spend a little bit more time today kind of diving into what those different treatment approaches might look like, anywhere from medications to, you had mentioned, physical therapy referrals. We also are aware of any kind of psychological therapies that might be beneficial for pain management situations. So can you share with us a little bit more about just little tastes of different areas of pain management therapy, pain management treatment that you might recommend or take your patients through?
Yeah, no, absolutely. I think that's I would say my main emphasis is to help patients find pain relief and improve their quality of life, with the goal of returning them back to their previous functional status. And this is achieved through a comprehensive and individualized care, as you mentioned. And we work with their team, with their other providers as well. So probably the mainstay, as you mentioned, with treatment options, with approach for our most common symptoms. First off is medications. This is fairly broad and complex. I think it depends. We tailor the treatment based on the patient's comorbidities, what other medical conditions they may have. But probably the most common treatment options that most people are familiar with would be anti-inflammatories. So people take Advil, ibuprofen. These are the common class of medications that people take to suppress pain from inflammation. Then you move on to what we would prefer to use as non-opioid adjuncts. So these are pain medications that are not opioids. So these can be a muscle relaxant. This can be a nerve pain medications. These are different classes of medications that are not habit forming that can help you with your pain if you're still having trouble. And probably the last class of medication we use, which would be opioid. And these are mainly for severe pain. That's not relief with the previously mentioned medications. And the use of these controlled substances does require close monitoring by pain management specialists like myself to balance the risk and benefit. So I think that kind of summarizes the medication aspect of things. And then you briefly mentioned physical therapy. I do see physical therapy and home exercise program with physician supervision and guidance as an integral component of success in my field. So, for example, I do provide a lot of interventional procedures to alleviate pain, such as epidural injections, nerve block, nerve ablations, and joint injections. But even if I improve these, the symptoms with injections themselves or medications, we still recommend physical therapy to correct the underlying disorder and deformities, which causes symptoms in the first place. So just by treating the symptoms, you may miss, on being able to do preventative care, which is what I'm pretty big on. And the goal would be to focus on these pain from preventing from coming back. Once we have successfully treated with the above mentioned options. And I believe one of the topics you mentioned was psychological therapy, neuromodulations. So we probably need to define what is neuromodulation in this instance. The technical term for neuromodulation, it refers to any sort of interventions that can affect the neuronal circuit. That can be the result of a chemical or electrical process. So you're essentially looking at a chemical neuromodulation as something that's achieved through medications that can affect your neurons that's responsible for psychological processing. In other words, pain. Your perception of pain can be modulated. So there are several medications that I do utilize in my practice that can help to reduce the pain level perceived by the patient. Something commonly that we see is someone that's in pain will actually have insomnia, trouble sleeping, and they'll also have depression. They have mood disorder because they're constantly being disturbed by the pain, and you're not getting good night rest. You're waking up, you're not well rested, and you're in pain. So this goes into another feedback loop that we try to break or interrupt with the chemical neuromodulations through medications. There's also another process called electrical neuromodulations, in which we do use a electrical impulse to essentially block your brain's perception, our ability to perceive chronic painful inputs. So this is done through a procedure as well. And essentially what we're looking for is to hijack the brain signal and prevent it from sensing the pain that's typically bothering you. So both of these methods can provide additional pain relief for the patient, in addition to what we talked about. I think lastly, something that we also use in the clinic, in addition to, would be regenerative medicine. And we can briefly cover this topic. I think people have heard a lot about this. One of such is therapy or proliferative therapy, in which we inject a chemical that's known to cause some amount of irritations, but fairly benign. For example, glucose that can be injected into the painful area. And the thought process is actually you want to stimulate growth with this. And so when you inject an irritant like this, it causes more inflammation, but these are beneficial inflammations. These bring nutrient, these bring growth and healing to that area. And so that's probably one of the first things that you hear about regenerative medicine. The next thing you hear about is PRP, which is plasma-rich platelet injections. These are fairly common in the sense that professional athletes actually utilize them to recover from the injuries, to get better. And they're looking for something that's not steroid-based. They're looking for something that's more natural. So this PRP process is something we extract from your body. We take your own blood, we spin it down, we process it in such a way that we obtain just the growth factors and re-inject into the injured area to stimulate growth. So this is something that we also provide here at the clinic as well. And in addition to, some people do ask about stem cells, and there are various different products for stem cells with the whole idea of re-injecting that into the body and regenerate that area as well. So I think that's a fairly comprehensive overview of the treatment modalities that I offer here in the clinic.
As you saying, people's pain is derived from psychological illness. Like I am aware that when there's a stress response, or that someone might feel like they're under a lot of stress, that can sometimes manifest as back pain, for example. Would you say you see that often in your practice?
So I think part of the psychological distress that we're talking about can certainly amplify the pain. It can certainly increase sensitivity to the pain, right? Because at the end of the day, all pain is perceived by your brain, right? It is all perceptions. You could technically have pain in a certain area. You prick your finger, it could be painful. Your nerves sense that, but the perception of that pain, how it's perceived and felt, it's painful because it's a threat to your body. That's all perceived in the brain. So, we do see a lot of interlocking between psychological distress and pain. And a lot of times, as I mentioned, I've had some success with putting patients on medications to help them with their mood. And in return, that also improves their pain. Just because of how these two play a very integral part of each other. I mean, if you have pain, you don't feel well. You don't want to do anything else. And I wouldn't say that the psychological component causes the pain, but I would say it can certainly amplify or cause increased sensitivity to the pain, which makes everything worse.
Yeah. And as you mentioned too, when you're in pain, that also can perpetuate the feelings of depression and so on and so forth. So it is a bit of a chicken or the egg type situation, I'm sure, between the two.
Mm-hmm. Mm-hmm.
Enjoy high-quality supplements shipped right to your door with full script through Private Physicians Medical Associates, PPMA. Reap the health benefits of pharmaceutical-grade vitamins. Set up your free PPMA account today. Visit privatemds.com.
So you mentioned a few regenerative medicine practices, which would probably be different than some of the more complementary type practices, which may include things like dietary modifications or maybe supplementation, vitamins, or even maybe other things like acupuncture or such. Have you seen any success in patients that have chosen to use those in conjunction with any of the pharmaceutical or physical therapy / regenerative medicine type treatments that you offer?
Yeah, absolutely. I think these are, we are a big believer in this clinic of using a multimodal approach, which means more than just one field. I am a physician, but I also, see patients benefiting from doing acupuncture. I mean, there's good evidence in medicine that shows that acupuncture can certainly help with, for example, depression. And at the VA, they're actually doing something called battlefield acupuncture to help with pain from arthritis. So there's actually good, solid evidence-based medicine for, these complementary alternative medicine treatments that you mentioned. And going back to complementary, for example, anti-inflammatory diets, I think that certainly can help. Just being, because a lot of the issues could go back to just inflammations. And if you're able to reduce inflammation throughout your body, that's great, right? If you're on a better, healthier diet and you're able to lose weight, that takes less stress on your back and your joints. I think that's all beneficial for you. So I've had a few patients that eventually switch over to a gluten-free or vegan diet, lost a tremendous amount of weight, and all of a sudden their knee joints, their pain in their joints got a lot better. And again, as I mentioned, it's twofold. There's the physiological loss of weight, which decreases the stress in the joints. Also, you're just having less inflammation going around your body. So I think that's certainly a beneficial treatment option. I think you asked me about supplements as well, supplementary diets. Yeah. So if we're talking about vitamins, these are, I usually tell my patients, I think these are fine for you to take. They're technically not meant to treat any specific conditions, but if you feel that they provide you some benefit, over-the-counter supplements, vitamins, I think it's a fair reason for you to be able to take them within the recommended dosage. I don't see any particularly big harm in that.
Awesome. And when it comes to the different treatment options that you have described for us today, do you feel that there's a hierarchy? Like, would you go to the medications or the physical therapies first before you do the medications? Or is it, of course, it's going to be an individualized approach. And I understand that it's very comprehensive, probably using a handful of these modalities in conjunction with one another. Is there more or less a hierarchy? Would you go to a certain type of treatment before kind of leveling up to others?
Yeah, sure. So my philosophy actually is less is more. So if I can give the patient less medications, less injections, and still achieve the same beneficial benefit, I prefer to go down that route. And when the patient comes in to see me for an evaluation, we discuss what I think may be going on with what's causing their symptoms. And then we'll discuss the various treatment options. As you mentioned, for us, realistically, there's really only 4 treatment options. One is, first off, is physical therapy, and then there's medications, then there's injections, and then there's a step is, if none of that helps you, would be surgery. So if you're talking about that, is there something we go to first? Usually I try to approach the topic with a conservative approach, meaning, have you done ice and heat? Have you done anti-inflammatories? Have you done physical therapy? I think those are a solid first start, regardless of whatever you decide to do. That's what I typically offer my patients. And however, we have to, again, as we mentioned, individualize their symptoms, right? If you're coming in to see me and you're in extremely excruciating pain, then we definitely may have to, start you on a stronger medications or even offer the injections if they're herniated disc. So we start off, as I mentioned, very conservatively, and then we can kind of go from there. I tell my patients that just because you choose one option does not exclude you from us pursuing the other treatment option as well. So some patients, they choose to do it one step at a time, and some choose to do pretty much everything all at once.
Yeah. Thank you for describing that. I think it helps people get a better sense of your philosophy too as a physician. So thank you for that.
Yeah, absolutely.
And about how long would you say that a patient is trying these different strategies before then you make the decision that surgery might be the best next step?
Yeah, so I would say at a minimum, I prefer for them to try 4 to 6 weeks worth of conservative care. So that probably typically includes physical therapy. Most physical therapy sessions go about 6 to 8 weeks. So once you get through about half of it, you have an idea whether this is helping or not. And then we go through our gamut of possible injections that may be helpful. And typically my philosophy is, if I've given you 2 injections and you have no pain relief, I don't believe that getting that 3rd, 4th, or 5th injection is going to be beneficial for you. If anything, it may be more harmful. There may be side effect. And these are, at that point, I'll talk to the patients and I'll approach the topic as, and listen, what we've done conservatively hasn't worked. So where are you at now? Or are you having so much pain where you can't do your normal daily function? Or is this pain somewhat of a nuisance, but you can live with that? Because for us, that determines whether this is something surgical or not. Of course, it comes down to the patient's preference. I see my role is actually as a counselor. I'm here as someone that can tell the patients, I think this is what you have. These are your options. And I like to be able to guide them to the correct option, the correct treatment. And a lot of times for us, if the patient doesn't see, doesn't believe, doesn't work with the diagnosis or the treatment, it's just not successful. So a lot of these, we're not in the age where the physician would tell the patient, this is what you have to do. I think now it's more appropriate for us to tell the patients, this is your diagnosis. These are treatment options. Let's talk about what's the best option for you, because what's good for one patient may not be what the next patient's looking for.
Yeah. And you had mentioned side effects, and I think it's worth using this platform to just educate anyone in our audience who might be undergoing pain management treatment right now. What are some side effects to look for that can indicate that they might not be tolerating whether it's a medication or an injection? Can you just rattle off some of those side effects, things for individuals to look for?
Sure. I believe mostly with medications, very common ones are tiredness or drowsiness. The way that these pain medications work on our body is that it can certainly affect your brain. So tiredness and drowsiness may be a common side effect. Some people get nausea, constipation. So these are things that we look for and see that we may need to adjust the treatment options. Because I think for everything else, if you're drowsy, if you're constipated, you're nauseous, that's pretty impactful in your life, right? And these are the big things that you can't get across, you can't get past. So those are side effects that could be common and definitely would be something that I would need to adjust their medications for. And moving on to injections, sometimes probably the biggest side effect I see, if we could call it a side effect, is that either the injection didn't work or the pain is worse because, it's irritated and we have to go in there and potentially give medication in an area that's already irritated. So they could have a pain flare up in that area. We determine after a few sessions to see where it's worth it to continue or not. So those would be probably things that I see most commonly as side effect.
Got it. Thank you so much, Dr. Nguyen. You provided us with so much wonderful insight into your practice. And for anyone listening who might not be familiar with you or your practice, of course, we mentioned it in the beginning, but can you just give us a little bit more information? How can someone find you if they're interested in working with you or one of your other doctors in your practice? If they want to schedule a consultation, where can they learn more?
If you just Google Orthopedic Pain and Spine Center or my name, David Nguyen, MD, you'll find our locations. We are located at 1640 Newport Boulevard, Suite 230 in Costa Mesa. And we also have a website. So our website is Ortho Pain Center, ORTHO, paincenter.com. And this is, I think, is a good resource for patients to go on and look at the conditions we treat, as well as the different modalities that we have offer to be available. And if they'd like to schedule a consultation, they can reach us at 949-736-5995. And one of my staff for the front desk will certainly help you go through the process of scheduling a consultation with me.
Thank you so much for your time, Dr. Nguyen. And thank you for everyone who is listening. Be sure to join us again in a couple of weeks for a new episode.
Thank you, Dr. Nguyen.
Thank you to both of you. Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.